Hi, my name is Sheree Suarez, and this is assignment 5, Healthcare System and Affordable Care Act presentation. Why is understanding our healthcare system relevant in the community psychology? Psychologists need to understand the healthcare policies and practices, which help psychologists consider how to access care to those in the community. Intervention often requires collaboration with healthcare providers, community organizations, and policymakers. Knowledge of healthcare system facilitates these partnerships and quality of service, helps psychologists design programs that meet community needs. The integration of mental health services within the healthcare system is crucial for holistic care. Community psychologists can work to ensure that mental health is prioritized and adequately funded within the broader system. Understanding the complexities of healthcare system enables community psychologists to engage in advocacy for policies that promote mental health, preventative care, and accessible services for all those in the community. They can often evaluate health programs and initiatives. A strong grasp of healthcare dynamics is essential for assessing effectiveness and recommending improvements. Different communities have varying beliefs and practices related to health, so understanding the healthcare system helps psychologists navigate through these cultural contexts and tailor interventions accordingly. In times of public healthcare crisis, like the pandemic, community psychologists can play a vital role in understanding how to mobilize resources and support community resilience, relying on the knowledge of the healthcare system. Okay, identifying some issues with the healthcare system. At this moment, there's many Americans that do not have insurance. Um, they do not get health care, meaning they don't see doctors. They don't have any. If they're sick, if they're in pain, they're not getting any prescriptions. If they need procedures, they're not having done. If they're just regular checkups, they're not going. And the reason is because of high premium cost and deductible cost. About 21% of the people do not get their prescription fills because they can't afford to pay. Those with insurance avoid medical visits to avoid procedures or what the doctor will tell them because they can't afford the out-of-pocket fees. Many of those with insurance report that currently their insurance is poor. I, for one, am one of those. I avoid as much as I can going to the doctor to not get, out of pocket. The cost, the copays to the doctor's visit, the specialist, getting any simple procedures is over the roof, and the deductibles is ridiculous, and it's not feasible. I can't pay for it. Explain your support or repealing the ACA. So in my research, the ACA there isn't much information on the pros and other than the pros and cons provided. But I do choose to repeal the Affordable Care Act because you do pay more on your monthly premium and have less medical coverage, which means you pay more, no deductible. Okay, but no deductible, no payments out of pocket means that the taxpayers pay more. So. Also, another thing about the ACA doesn't give any coverage for dental and vision for adults, only for children. Today I actually called to find out what the difference, through the ACA, Obamacare, what would it be to have insurance with them opposed to the private insurance that I have through my employer. And they gave me a plan. It's a PPO, just like the one that I have. I have a copay, which is cheaper than what I have. I have no deductible. I get coverage 80% for my prescriptions. I'll get coverage for hospital stay. Any type of procedures that I need to have done, it'll be covered. I have open access, meaning that I can go see any doctor that I want. There is an enrollment fee of $100. The dental coverage is about 65% on all around, meaning my cleaning is covered at 65%, x-rays is covered at 65%. So the premium is about $300 a month. I currently pay something similar. My coverage right now is similar to this, and I pay $188. Yes, I do have a higher deductible. But I don't really have all these procedures that I go to. I be paying a lot more. My dental coverage is higher. It's better. I don't have 65%. My cleanings are covered 100%. I have a lot of things that are covered at 100% that I don't have to worry about, as opposed to if I change to the Obamacare plan. And yes, I don't have a deductible. Yes, copays are a little bit less, but my premium is high and I don't have the same coverage. Okay. The thing about the Affordable Care Act, that it does help those within the poverty level to obtain affordable health coverage, complete medical coverage to all who qualify. It's a benefit to those who are unemployed and disabled. Most children who need health care, they'll receive medical, dental, and vision, and they're covered completely. The adults do not get dental, and they do not get vision or dental. There's no vision or dental coverage. It does cover for drug and alcohol treatment, pregnancies, and mental health coverage. Okay. So there is a lot of things that are great, and there's a lot of things that are not so great. I do agree with, like having less to pay on my insurance, no deductible, out of pocket's a little bit less, having better coverage. But I don't agree where it's a mandate that if I don't choose to have insurance, I'm going to be fined. I don't agree with that. I think that everybody should have the choice to have insurance or not. Um, it's just it's the United States. I have that freedom, and I don't agree with a bigger government. And having government within the healthcare just doesn't go with my beliefs. So I have to go with repealing the Affordable Care Act. Thank you.